Welcome back. It is 7:44. So you or your student might feel anxious to return to that in-person learning after Governor Jay Inslee announced K through 12 can get back to the physical classroom. So we want to address any concerns you might have with the help of a mental health professional. Dr. Terry Lee is the Behavioral Health Medical Director at Community Health Plan of Washington to help us out with this morning. Dr. Lee, thanks so much for joining us. Hi.
Hi, how are you doing?
Good, good. Thanks for being here. So, after so many months of learning from home, this is a very big change. So, what can parents do to prepare their kids right now?
Yeah, well, I think the key to preparing is to do your own homework and gather information and prepare. So this would include things like um, talking to the school and understanding what their policies and practices will be for reopening the school. I would also talk to your child's teacher and learn like what specifically they'll be doing different and how they feel about the reopening of the school.
Um,
Then I would sit down with your child and have a very age appropriate, emotionally neutral discussion on what to expect. So these could involve things like wearing masks, desks might be further apart, there might be partitions or barriers in the classroom. Maybe there'll be changes in how the kids enter the school or eat lunch. So in discussing this with your child, I would assess how your child is feeling about this. You could also talk about how the changes are for safety, and you could also highlight the positives of reopening school and returning to school.
so,
If your
Doctor,
child's having some, oh,
oh, sorry.
go ahead.
I guess I was just going to ask if you're a parent and you already kind of feel that anxiety and that stress, what are some coping mechanisms for that for a child?
Yeah, so as a parent of children that are out of school, I know there can be all different reactions. Some may be anxious about going to school, others may be happy to go back to school. As far as any anxiety, if your child is expressing some anxiety, I would talk about what might help. So some children might benefit from visiting the school before school actually starts, just visiting and seeing the classroom and seeing like what it's going to be or look like. If there's some accommodation, like sitting in a certain part of the classroom, some kids might feel better sitting in the front. Others might want to sit on the sides or in the back. If that would help, I'd make that request to the school.
I noticed you mentioned having age-appropriate conversations. How do those change concerning where a kid is at in their age and their education level?
Yeah, I think with younger children, you would want to use simpler terms and um, present things in a more straightforward way. Um, with an older child, you could uh, introduce more abstract ideas like that there are positives to returning to school and there are some potential negatives. And there you could try to balance and weigh things out in a more subtle manner.
Dr. Terry Lee, thank you so much for joining us. We certainly appreciate it as we start to transition the kids back to the class. It's definitely going to be new and exciting and and maybe a little stressful. We appreciate it. Thank you.
Thank you.